Dentsply Cavitron presents Periodontal Debridement with Ultrasonic Scaling, an evolving technology. This is a quick look at progress in our profession. In the next few minutes, you'll see how things are changing in thinking, technique, and equipment. And you'll see a demonstration of the latest insert from Dentsply Cavitron, a breakthrough device that combines the access of a slimline and focused spray water delivery, FSI Slimline. Cavitron introduced the first power scaler with ultrasonic inserts. Since then, ultrasonic inserts have come a long way in three key areas: water delivery, clinical utility, and access. In 1954, Cavitron designed the first ultrasonic insert, the classic P10. It was a breakthrough for its time. Water was delivered through an external tube, cooling the insert and removing debris. The P10 was the first widely used general ultrasonic insert. Next, for subgingival scaling, we added the classic EWPP perioprobe insert. Its probe-like design permitted water flow to subgingival areas. Now let's look at the next evolutionary step. In 1974, Cavitron introduced the TFI series, featuring the TFI-10 insert. It eliminated the external tube and delivered water through an internal channel at the end of the plastic grip. In 1987, the TFI series of inserts was expanded to include an additional frequency, 30K. This raised the clinical utility of ultrasonics to a new level. The TFI series also included the TFI EWPP perioprobe for subgingival scaling. Its probe-like design permitted water flow to subgingival areas with no external water tube. This was a superior design compared to other inserts available at that time. The most revolutionary innovation in ultrasonics occurred in 1992 with the introduction of the slimline SLI-10 insert. With a 40% thinner tip, the SLI-10 redefined subgingival access. It allowed the clinician to treat subgingival pockets to maximum pocket depth, where previous inserts had never been able to reach. Designed with the external water tube, the Slimline series of inserts also redefined the concept of a universal insert. Until Slimline, one straight insert was used for all applications anywhere in the mouth. A straight insert should be used for deplaquing and gingivitis patients. Based on the needs for access and pocket depth, the Slimline right and left inserts were designed. Similar to the 4R4L double-ended curette, the Slimline right and left inserts are a complementary pair. This selection of angled inserts made adaptation easier in many areas of the mouth, such as the maxillary posterior lingual roots. Another breakthrough in ultrasonic inserts came in 1995, when Cavitron perfected focused spray technology. You can see it in the FSI-10 insert. Water flowed through an internal channel at the active tip of the insert, and scaling efficiency was improved for light to heavy supragingival calculus. But the insert that truly redefined subgingival access was the FSI Slimline insert. For the first time, slimline access and focused spray water delivery came together in one extraordinary insert. Like the original Slimline, the FSI Slimline is thinner than standard inserts and eliminates the cumbersome external tube. The FSI Slimline provides superior subgingival access and clinical debridement to make adaptation easier. The FSI Slimline series of inserts includes right and left-oriented inserts, and 25K and 30K frequencies offer compatibility with most ultrasonic scaling systems throughout the world. FSI Slimline series inserts are the best combination. Slim enough for excellent access, with enough water for effective lavage without obscuring your working area. It's easy to see why the FSI Slimline insert is so revolutionary. Focused spray water delivery, clinical utility, superior subgingival access. And in the fight against periodontal disease, access is everything. You've seen how Cavitron ultrasonic inserts have evolved over the years to match your needs. Now, let's find out the latest thinking on periodontal therapy. To hear how things are changing, let's listen to Linda Rubenstein DeVore, the chair of the Department of Dental Hygiene at Baltimore College of Dental Surgery.
Before we talk about what's going on in our profession today, let's look back a few years. Conventional wisdom favored hand scaling over ultrasonic scaling. In addition, dental and dental hygiene school curricula emphasized hand scaling and taught ultrasonic scaling for limited applications. Times have changed. First, with the continued development of technology, ultrasonic scaling has become an essential component of treatment. Now, dental and dental hygiene schools are incorporating ultrasonic scaling into their curricula. And periodontal debridement through ultrasonic therapy will soon be the standard of practice. This change in thinking is a paradigm shift from ultrasonic scaling as a treatment for gross calculus removal to one consistent with today's more sophisticated periodontal procedures. In the past, the goal was prophylaxis. Today, it's periodontal health. Why is our profession shifting from gross calculus removal to complete periodontal debridement? Because ultrasonic scaling can help you achieve a biologically acceptable root surface. What's more, you get deep pocket access without losing tactile sense and without causing patient discomfort. In short, ultrasonic treatment is the latest wave in periodontal therapy. The key benefits of ultrasonic scaling have been established in several refereed journals. Gram-negative, anaerobic, free-floating bacteria can be up to 60 times more pathogenic than adherent bacteria. Ultrasonic vibrations virtually eliminate these microbes. Ultrasonic vibrations rupture the cell walls of harmful spirochetes and motile rods. This makes ultrasonic therapy particularly good for treatment of ANUG and advanced periodontal disease. Endotoxins, or LPS, form a weak bond to the root surface in the superficial layer of cementum. Up to 60% of endotoxin-secreting bacteria can be lavaged away. FSI Slimline inserts can disrupt bacteria colonies to the maximum depth below the gum line. Protein cells encourage reattachment. By leaving these fibroblasts, you can facilitate the regrowth of fibers between the gingiva and the root. Ultrasonics will not strip the tooth like root planing with curettes. One point should be emphasized here. Only power scalers deliver bacteria-killing sound waves and deep cleansing lavage, two benefits hand instruments cannot offer.
As for which insert is most effective, research points to inserts like the FSI Slimline for subgingival debridement and the FSI-10 for general supragingival scaling. It's time to take a look at the proper technique for ultrasonic scaling. Begin every procedure by preparing and involving your patient.
I'm going to be reviewing your med history to make sure.
With patients predisposed to diseases spread by aerosols, patients with respiratory ailments, or patients with older unshielded pacemakers, utilize other methods of scaling. Sonics and ultrasonics in areas of demineralization, on restorations, or in areas of extreme sensitivity are not indicated. The more your patients know, the more relaxed they will be. Patients enjoy knowing that you are providing care using the latest technologies. As you would for all procedures, provide a pre-procedural mouth rinse, eyewear, and a patient bib. Patients should be positioned parallel to the floor, with their heads positioned for good clinician visibility. With the FSI inserts, the clinician will notice a significant decrease in extraoral spray, making the procedure more comfortable for the patient and the operator, as well as improving visibility when using indirect vision with a mirror. Prepare for ultrasonic scaling as for other preventive and therapeutic periodontal procedures. Wear appropriate eyewear, gloves, and protective apparel. Wear a face mask with a high bacterial filtration efficiency. Position yourself for maximum visibility. You and your patient are prepared. It's time to select the appropriate insert and begin. There was a time when a clinician would select ultrasonics only for patients with heavy calculus. With the advent of the slimline inserts, and now the focused spray slimline inserts, the clinician can provide preventive as well as therapeutic care, utilizing ultrasonic technology. In addition to insert selection, your technology selection is just as important. Cavitron magnetostrictive technology is working for you. All insert surfaces, the lateral borders, the back, and the face are active. Research has shown that the optimum frequency range is 18,000 to 32,000 cycles per second. For example, active tip area and cavitation activity of an insert decreases significantly above 32,000 cycles, minimizing clinical efficiency. Now that you have made your technology decision, your insert selection should be based on 6 criteria. The purpose of your treatment, that is, preventive or therapeutic care. The patient's oral health or disease classification. Determine if you will encounter a shallow sulcus or complex root anatomy with concavities or furcations. The location of the deposits you are about to remove, supragingival or subgingival, the degree of the deposits, light, moderate, or heavy, the design of the insert, straight or contra-angled right and left, the diameter of the insert tip. Now, a review of proper preliminary procedures for setting up your unit. This provides adequate water supply for the insert. It also eliminates potential entrapment of air bubbles in the handpiece, which could cause it to become warm. Gently turn the insert until the O-ring snaps into place. Use the lowest effective power setting to match the calculus removal level. And consider these factors. Water serves 3 purposes in power scaling inserts: to cool the insert tip, to flush out free-floating, highly pathogenic bacteria from the pocket, to remove debris from the work area. To achieve optimal flow, adjust the control until the water stream flows with a rapid drip. When using the FSI Slimline subgingivally, the focused water spray is directed into the treatment area, the pocket, not outside the patient's mouth. Using ultrasonics offers the clinician 3 benefits. Ultrasonics are quicker, more efficient, and less fatiguing. Before we begin our procedure, let's review the basics of instrumentation. Pick up the handpiece. Drape the handpiece cord over your arm or between your little finger and ring finger to eliminate handpiece drag. Using a pen or modified pen grasp, hold the handpiece lightly, like a feather, so that someone could lift it from your hand as you are working. This is contrary to the tight activation grip with hand instruments. Intra or extraoral fulcrums are acceptable because of the light touch of the operator and the benefits of a power scaler doing the work. One approach is to rest your hand lightly on the patient's cheek. Cavitron magnetostrictive technology provides inserts that are active on all surfaces. The point of the insert tip generates the most power. Adapt the insert so that its face, lateral borders, or back are parallel to the root surface. Make certain the point is not directed into the root surface. As with a hand instrument, if the insert point engages the tooth surface, root gouging can occur. The suggested technique allows access and adaptation to decrease the possibility of inadvertent root gouging and latent hypersensitivity. Touch the root surface very lightly. Use smooth, gentle, overlapping strokes. Imagine that you are coloring the root surface with the insert. For tenacious deposits, keep the insert in contact with the deposit using a light touch. Heavy pressure, such as that used in hand instrumentation, will actually decrease the efficiency of the insert and prolong the procedure. Keep the insert in motion at all times when touching the root surface. Just as a violinist would stroke the bow over the strings, keep the insert moving on the tooth surface. Now that you've finished your preparation, let's begin the procedure. The Focused Spray Insert Series features inserts such as the FSI-10 for general scaling and the FSI Slimline for subgingival debridement. The FSI-10 is ideal for supragingival calculus removal, including bridges of mandibular lingual deposits. The significant decrease in aerosol production is especially appreciated for maxillary anterior facials. No more giving the patient a bath. The FSI Slimline Straight should be utilized for patients with no bone loss, such as those requiring subgingival deplaquing, and for therapeutic treatment of gingivitis. Gingivitis traditionally has been treated with hand instruments. The goal of treatment is to disrupt the subgingival matrix to allow the ulcerated epithelial lining to heal. Often, hand instruments were too bulky and uncomfortable to fit into the sulcus, causing unnecessary tissue distension, which translated to pain for the patient. The focused water delivery of the FSI Slimline Straight gives superior lavage, and the thin, probe-like diameter allows access to the base of the pocket without causing tissue distension. Your patients will thank you for a comfortable appointment. For patients with bone loss, mild, moderate, or severe periodontitis, the contra-angled right and left inserts are the instruments of choice. Together, these two inserts work as a complementary pair, like a specially designed universal double-ended curette. They help you follow the anatomy of the root and provide maximum access and better adaptation to the complexities of root anatomy, including root concavities and furcations that are encountered in the treatment of periodontitis. Research shows that 58% of all furcations are more narrow than the narrowest curette. The FSI Slimline complementary pair of inserts is ideal for these difficult access areas. How do you determine which insert is the right and which is the left, and where should each insert be used? Observe the contra angle from the back of the insert while holding the insert away from you. The contra angle that is oriented toward the right is the FSI slimline right insert. The contra angle that is oriented toward the left is the FSI slimline left insert. The information is stamped on the insert stack, along with the date that the insert was made. Using the back side of the FSI slimline right and left inserts allows the curve of the inserts to adapt naturally to the root concavities. This position has been described as the opposite of what you would do with a hand instrument. Also, unlike hand instruments such as Gracie curettes, where blades are used for specific surfaces, such as mesials or distals, the FSI slimline right and left inserts are used on contralateral surfaces. The FSI slimline right insert gives you excellent adaptation in the lower right buccal and the lower left lingual areas. The FSI slimline right insert is also the choice for the upper left buccal and the upper right lingual areas. All surfaces should be instrumented with the FSI slimline right insert before changing to the complementary FSI slimline left insert. Only one change is required, compared to switching between 3 or 4 double-ended hand instruments. The FSI slimline left insert works on the contralateral, opposite surfaces compared to the FSI slimline right insert. That is, in the lower left buccal and the lower right lingual areas. You should also use the FSI slimline left in the upper right buccal and the upper left lingual areas. Evaluation is an extremely important part of treatment. Periodically, use the deactivated insert to explore and evaluate the root surface. The probe-like diameter allows greater tactile sense to the clinician. Exploring with the insert, then activating it again if a deposit is found, also saves the clinician time. How do you know when you are finished? Because the goal is periodontal debridement and no longer stripping the tooth to produce hard, glass-like roots, the clinician can use several visual and tactile cues. Observe the lavage from the pocket until no more debris is sighted, or the liquid does not contain any white material. Tactily, the root should not have any convexities or bumps on the normal anatomy. After periodontal debridement is completed, the treatment plan should be reevaluated for the necessity of further periodontal care. After periodontal debridement with the FSI slimline insert, follow these steps for cleaning and sterilization. This is crucial for assuring sterility and preventing cross-contamination. To remove gross debris, rinse the FSI slimline insert under running water or immerse it in a mild, basic pH ultrasonic solution. Rinse thoroughly with water. To maximize the useful life of the FSI slimline and all Cavitron inserts, steam autoclaving is the preferred method of sterilization. To achieve sterility, follow these steps. Place the paper side up when using a combination paper-plastic autoclave pouch. Do not use totally plastic autoclave pouches, as the plastic may adversely affect the handles on certain inserts. After warm-up, operate the autoclave at a sterilizing temperature and pressure of 273 degrees Fahrenheit and 31 pounds per square inch, or 134 degrees centigrade and 216 kilopascals, for 12 minutes, followed by a 30-minute drying time. Leave the FSI slimline insert in the sealed pouch to maintain sterility until it is ready for use. Alternative sterilization methods are available, such as dry heat and saturated chemical vapor sterilization. Cold sterilization is not recommended and will void all warranties on Cavitron inserts. This concludes the Dentsply Cavitron presentation on ultrasonic scaling, periodontal debridement with ultrasonic scaling, and evolving technology. You've seen how things have changed in thinking, technique, and equipment. And you've seen the instrument that is redefining the word performance, the FSI Slimline Insert. At Dentsply Cavitron, we pride ourselves on innovation and excellence. That's why we're recognized as the company setting the standard in ultrasonic scaling. Remember to ask for Cavitron by name. And if you have any power scaling questions, or if you want more information, please call 1-800-877-0020, extension 471.